You have questions? We have answers. Welcome to the Therapist Question Box with your host, Miss Lindsay Schiss.
Welcome back to another episode of the Therapist Question Box. We are here to answer your questions, whatever they may be. As a reminder, you can ask questions on the Therapy Utah website, or you can ask questions where you stream this podcast. It is awesome to have listener questions, and it is what keeps us going. So ask away. Today, I have with me Mary Lamas. Mary, thanks for joining us.
I'm glad to be here again.
So I know it was so fun to have you that I wanted you to come back on. So thanks for being here. Mary, I think this question is a really good one. And it's one that people, when they're looking into therapy and wondering about it, really, it's a question they're asking. And it's why we have so many referrals. So I'll go ahead and just start. The first part of the question is, how can I tell if my therapist is a good fit? And what kind of therapy do I actually need? So I feel like it's kind of two questions in one. So let's start with the first one. How can I tell if my therapist is a good fit? So what does a good fit between client and therapist really mean?
This is such a fantastic question because I can't tell you how many times I have been the client in the past. And honestly, most therapists, whether they're social workers or marriage and family therapists or psychotherapists, anything, we have been on the other side of that table and have experienced going through our own therapy. It's one of the reasons why we practice therapy, right? And
Absolutely.
I will tell you that I have gone on Google or on my medical insurance list or friends' recommendations on Facebook because I'm old and don't use Instagram enough. But and just been paralyzed by the how do I know? And I wish there was a really good rating system. I haven't found one yet, but finding a therapist when you need help is really a big step. That sounds kind of silly to say, but it can be really daunting. How do I know if, Adam Anderson or I can't think of any Z names, Zachary Zinfandel.
That was easy. Good job.
There you go. How can I tell which one is going to be a good fit? And it can be really daunting. And when you go into the office and you're not feeling it, I think it doesn't always happen right away that you don't feel it. But after a few sessions, you kind of get a vibe. And if you're not feeling it, then it feels overwhelming again. Well, how do I know the next time? This is one of the things I really love about Therapy Utah is that we love referrals. If my style, if my personality isn't jiving with somebody, I can definitely refer them to somebody else and feel like I'm handing them off in a good way. One of the most important things to think about is just, do you feel safe and respected? I mean, that seems like a very simple thing, but I've been on the other side of a therapy session where I didn't feel heard or respected, and I just shut down. I didn't want to talk to them anymore when things felt oversimplified or something like that. So just feeling kind of comfortable is really important, and something that we do at Therapy Utah, which I would recommend for anybody. I think any therapist worth their salt is going to be able to give you a consultation. And that's not a therapy session. You're not going to be firing away with all your deep, dark secrets. But it can just be a Zoom meeting or an over-the-phone meeting, and you can just kind of get a feel for that person and their energy and the way that they speak. So personally, I'm a pretty upfront person, and I don't mince words with my clients very much. And that is really great for some people, and other people really need a more gentle approach sometimes. They would prefer someone with a softer voice that maybe laughs a little less or something like that. And so that's when I can say, you know what, that's fine. Let me direct you to this clinician or that clinician, and they have that kind of a style. And it's a great thing to be able to refer other people to. But that vibe is really important. And I think a consult is a great idea.
Yeah, I love that idea. And I think it's really important to remember that you get to choose. And some, even what you said was really important. When a person calls a therapeutic office, when they call Therapy Utah, it's a really vulnerable call.
Mhm.
Like, okay, I'm finally actually doing the thing. I'm making the phone call. I'm making the appointment. And that's hard in and of itself. I think we need to just give credit for that because that's hard.
Yeah.
And then going, okay, now the next step, is this person going to jive with me, right? And that's why referrals are such a big deal, because you're like, okay, if my best friend, my mom, my sister, my aunt has gone to this therapist and really liked them, then okay, I may as well, right?
Yeah.
So it's helpful to do that as well. But one of the things you said is if you feel comfortable with them. And I just kind of want to go back to that, because I think a really important thing is therapy is uncomfortable.
Yeah.
So how do I know that, okay,
Yeah.
they're making me uncomfortable, but is that part of therapy, is being uncomfortable? And how do I differentiate between the two?
That's a really good point. Okay. And listening to yourself is a good thing. So therapy should feel uncomfortable sometimes. It should feel challenging, uncomfortable. It should feel like, I don't know, like maybe a good workout where you're like, man, I really had to reach in there and work for this. And it got uncomfortable and I'm going to be a little sore for the next couple days. But boy, do I feel like I am gaining something from it. And I feel like I can see what's going into it. And that really is the point. On a consultation, that's why I am recommending a consultation, is that you are able to talk to them just kind of as a person, ask them what they're about, their style, their modalities that they use, which we'll talk about a little bit later, and just kind of get to know them as a person. And if it doesn't jive with you, then that's fine. And that's great. You didn't actually need to go into the office to know, like, this isn't quite a good fit. And if you have a good clinician, they're going to be able to refer you somewhere else and not, and this is where it feels really hard. You're like, oh shoot, am I going to hurt their feelings if we met and I don't want to move forward in treatment? But a good psychotherapist is going to be able to understand that they're not going to be a good fit for every client, and that the client being able to feel comfortable and heal is the most important part. And that's what we're focused on.
Absolutely. Such a good reminder that this is the client's work, right? And yourself as the client, right? I always say that to people, like, you are the expert in your life. I am not. So if there's discomfort there, or there's something that maybe you don't think it's really working, then honor that. Mm-hmm. Go with that. And I love the idea of you will feel uncomfortable, just like working out. It's not, you don't go there because you want a relaxing experience. Right. You go there because you're working out, right? Yes. So that's the goal, is we want to work. We want to do that work. But I do think there's a difference between that kind of work and, I don't know if this is quite working for me, right? Right. So really good. Any other thoughts as before we move on to that second part about just a therapist being a good fit, right? I mean, do we need to take into account religion? Do we need to take into account gender? Do we need to take into account, things like that? Do I need to say, you know what, I need someone that's my same religion, my same sex, that, has similar values to me? Does that matter?
That's a really good question. And it feels like it would matter, right? Personally, I feel that a good psychotherapist, our job is to try and put your values as a client onto the lens of whatever we're talking about. So I don't need to be the same gender, religion, culture, anything like that as my client. However, as a client, if I'm coming in, I lived in Los Angeles for many years, and I saw a couple different therapists down there. And I came in and said, I am a member of the Church of Jesus Christ of Latter-day Saints, and many people aren't very familiar with that. So I did understand that as a client, I'm going to spend some time, any client, you're going to spend some time talking about your value system and what's important to you and what's kind of a non-negotiable, that sort of a thing. But I can meet with someone who can appreciate that faith is important to me and that this value system is important to me. And then we throw that lens on our practice, and that's really important. Some people, that is really important to them, like in the LGBTQ community, that could be really important that you have a therapist who understands that world and has been a part of it. Different minority groups, it is helpful to have at least knowledge. But I know that as a therapist, if I feel a little bit out of my depth with a culture or some aspect of my client's life, I kind of love that because I take it as a challenge to learn more. And I will do a deeper dive into things that are important for them. And if I feel out of my still feel out of my depth, then I try to help them find someone who can help, right? So I do have my own life experiences, but the whole point of being a good therapist is that I can try to help you in your value system through your lens. And learning is, for most therapists that I know, learning is a passion, and we love the challenge of being able to understand the world through a different lens. So it is a little bit of a personal question and what your preference is, but a good therapist is going to be able to adapt and help.
I totally agree with that. And in fact, I literally was just having lunch with a friend and she was talking about that. And I was telling her, like, actually, it's not my job to change a person's values.
Right.
But my job is to say, what are your values and how are you living in your values? And then let's try to get those things congruent, right? Versus, this is the way I think, this is the way I live my life. And no, they don't care the way I live my life.
No.
That's not what it's about. It's about them and me meeting them where they're at and then helping them on their path, right?
And that's a point I would like to come to also in choosing a therapist, is that you are not going to a therapist to hear, it's not like going before this all-knowing person whose life is always this organized, lovely, storybook and getting the wisdom from the oracle. That's not what it's about.
Amen.
Yes.
If we had that mantle, that would be way too much and nobody would do it. Yeah, I agree.
For sure. So what you're doing, so a lot of people come to therapy and they're looking for the right answer. And that's really not what you're going to find in therapy. What you're looking for and what you're going to find is your right answer. And sometimes there are more than one right answer. And for example, in couples therapy, you're taking two different lenses and you're blending them together and learning how to look together through that lens and learn what works for this group, this couple, this family, whatever that might be. And that changes, right? Me as a person, the way that I behave in some situations, that's different when I'm in a couple and I'm thinking about the couple or my classmates or something like that. It's always different. And it's important to know, I think a lot of people come into therapy thinking, okay, this person knows a lot more than me, so I'm just going to sit here and be like, what do you think? And I have never, hopefully, I better knock on wood as I say that, told a client, well, what I would do or what you should do or something like that. Because that's not what they're there for. They're not looking for the world according to Mary Lamas. They're looking for what works for them. And that's really what therapy is about. And I think finding a clinician who understands that people come in with that kind of power dynamic of like, oh, the therapist knows a lot more than me. Like, it always makes me laugh a little bit internally because we definitely do not have our lives worked out.
Amen. Yep.
But the therapist can say like, no, actually, like, we're just kind of in this together, and I don't know, some cool stuff that'll help us along the way. But we're both on the same level working towards this.
Yes. I like to think of it like a Sherpa. Like, we're just going up the mountain together, and sometimes the Sherpa has got to carry more. Sometimes they don't have to carry and they can give you more, right? But that we're moving together in that.
Yes.
And, I really think what you were saying is really important. Like, you never say, oh, I would do it this way, or I would, because they don't care the way you would do it, right?
Yeah,
And
they can get that from their friends.
Right. Yeah. They don't need to do that. But, I think a good therapist helps you to trust yourself more, not trust them more.
Correct.
Trust yourself more.
Yes.
Because that's where, when we have self-trust, we can say, oh, wait, I actually have an inner knowing. I'm the expert in my life, right? Not the therapist. And when the therapist can help you see that, oh my gosh, that's empowering.
Yes.
Right?
Yes.
Because then the therapist leaves, or it changes, or you finish therapy and you don't all of a sudden go, oh my gosh, I gotta be tied to you forever because you know the answers. No. The client knows the answers. They always have. Just sometimes we have to help guide them to those answers.
Yeah. You just have better tools to do it.
Exactly.
Yeah.
Yeah, exactly.
Love that. Yep.
So, how do we let's talk about, how do we know if there are signs that therapy is not a good fit, or the therapist is not a good fit? Like, are there any red flags that you would say, okay, that's really clear that we need to make sure to stay away from that?
Yes, absolutely. I'm going to say, if you get any ick factor of any sort, and you can translate that as you will.
Okay. I was going to say, what would you say is an ick factor?
Well,
it's different for everybody.
It is different for everybody, right? And sometimes we have reactions to people that aren't fair necessarily, because if I have a history with someone who looks a certain way, and my therapist looks the same way as this person that I have trauma with, that's not going to work. And that's not the therapist's fault. That's not my fault. It doesn't matter. It's that it's not going to work. I cannot open up and be vulnerable with this. And so if you have something that's like, no, totally can't do it, then listen to that and go with that. You really need to trust yourself. You're not going to marry this person, but you're going to be so vulnerable with this person if you're doing the work and getting there. And so it's important to spend some time on the relationship, and a good therapist will do that right out the gate, and ask what you need and what your goals are and things like that. And we'll listen to what you have to say, and you guys can kind of work on it as you go. I always invite my clients to open up and tell me exactly how they're feeling about things. And that can sound really like upfront. Let me say it a little softer. I invite feedback, and I try to invite it in ways where it can be comfortable and soft, because I would not come out and tell a clinician, you know what, I just don't like your style.
Right.
So
wouldn't be that harsh.
No, yeah. but I might be able to say, well, I mean, sometimes I get my feelings hurt a little bit, or it feels a little much, something like that.
I love that you give them the space for that, though. That you're like, I want to hear your feedback. Yeah. I'm open to it, and let me know.
Yeah. That's really important. I would say, please don't go to a therapist who isn't inviting a collaboration, and who isn't inviting you to give feedback and is taking that with consideration and not taking that personally. Because again, we're not there to impart our own wisdom and our own opinion on things. So the reverse of that is that when it's not working for a client, that's not personal. That's just the flow of things and what they need and
dynamics. Yeah, that just can happen. Absolutely. I love that idea of collaboration. Yeah. Like, we're in this together. You're not better. I'm not worse. You're not no, we're actually in it together. We're learning together. And I think it's really important what you said earlier is, how you are going to help a couple is going to be different with each couple, right?
Yes.
It's not like you're just the Zen master and you're like, this is the only way to do it. But you look at their life experience and their history and all those things, and you incorporate all those tools to match them, right?
Yeah.
So really good. Okay, now let's move to the second part of the question, which is, what kind of therapy do I actually need? So this is interesting, because I think I think maybe 5 years ago, that question would have never even come up, because people would have been like, what do you mean? But now we have TikTok and we've got Instagram that talk about different therapies, right? Different modalities. So, I don't want to get too much into the weeds on this, because we have a million acronyms that we use for therapeutic modalities that people are like, what is that? I remember when I first started going, there is an acronym for everything. What is it? What is this field? It's so crazy. So what would you say, like, and does a client need to be worried about that? Like, is this a client's job? Let's say, first of all, before we say what kind of therapy do they need, does a client need to be worried about that?
Yeah, this is such an excellent question because I, like most people, thought that there was kind of, we call it, speaking of acronyms, it's the TOW, treatment as usual, right?
Okay.
And that, it generally, when people think about going to therapy, they think about the couch and the talking about the childhood, and they're just talking, right? And when I went back to school, I was very surprised to learn all these different modalities that are really amazing and different, that put your body more into it, that different things explore your body more, your heart more, your mind more, your mindfulness more, things like that. There are a million different things. I just heard the other day about hiking therapy, and I feel like I should probably try that at some
That sounds
point,
great,
right?
Too. Yes, look into that.
Yeah, that's like double therapy. Right?
Exactly.
So there are so many different types. And again, this is where you can get really overwhelmed as a client looking into that. I'm going to say, if you've been on TikTok and you saw something that was really intriguing to you, let's go with EMDR. Most people who are a little bit familiar with therapy are familiar with EMDR. It uses motions, eye movements, the different sides of your brain to kind of process through some trauma that has been like clogging up the system, if you will. And it's really effective. But I remember the first time I heard about it going, okay, so like you wiggle your eyes and this is supposed to like process your deep, dark traumas. That is ridiculous, right?
Right.
It was way too woo-woo.
Yeah.
Now that I know more about it, it is a brilliant therapy that I think is just so life-changing for so many people. However, if Mary Lamas 10 years ago came in and was like, okay, we're gonna, the clinician said, we're going to do EMDR, here, I'm going to wiggle my finger without any other introduction, I would have never come back. Right. But when you have a little bit of education about it, you can look into it yourself. There are people that love looking into it themselves, and they have this whole list of modalities, and they go, I don't want to do this. I don't want to do this. I do want to do that. This is going to work. That's not going to work. That's a type of personality that, okay, great, that you feel confident about what you researched. We're going to talk about it and tailor it to you. However, I like that you've already done some investigating. Then there are people that are more like me that's like, well, I kind of heard about this, but I don't know. What do you think? And honestly, that's why I went to school and got licensed, and I'm a therapist, and I learned about different modalities a little bit, and then I selected other ones to become more deeply educated in. And the cool part about our office is that we have lots of different modalities in our office. So when a client wants to try EMDR, there are people that can do that. When a client wants to try play therapy, even for adults, in fact, I did my first sand tray therapy as an adult, as a patient the other day.
Interesting.
With one of
what
our
do you
therapists.
think?
Oh, I loved it.
Yeah.
I loved it. It was amazing.
Yeah.
And even coming in as a therapist, I was trying not to kind of taint the process with like therapy thoughts. And I was very amazed at what came out. Yeah.
Yeah. I think it's amazing because, first of all, we have so much information now. So if you had interest, like you said, gosh, you can watch it on YouTube and
Absolutely.
You can go, okay, what's an EMDR session? You can see what it looks like. You can see a sand tray or a play therapy session and really get clear about what it is, right? I think the other piece that's really important is to recognize, like, it is going to be tailored. So what you see in that session may not necessarily be what your experience is going to be, right?
Yep.
And here's the other good news is most therapists are not just trained in one thing. Yeah. Right? This is one tool out of the toolbox to use and go, okay, let's try that, see what you think, and then collaborate and get that feedback, right? Yeah. I mean, as you were talking, I thought about my own experience, and I had a CBT therapist. So CBT, again, an acronym, cognitive behavioral therapy. So very much thinking, think, behave, act kind of way of doing therapy. And it was awesome. And I was like, he was great. It was great. Well, then my daughter got in a car accident, and it brought up some old traumatic memories for me.
Yeah.
And I didn't really even, and she was actually fine. But I have a history with my mom being in a car accident who wasn't fine.
Yeah.
And it brought up so much inside of me that I didn't expect. And she said to me, "Hey, have you tried EMDR before?" And I said, "No." And she said, she was a colleague of mine. And she just said, "I would love to do some sessions with you on EMDR." I can't tell you how profound it was. I have been working through this for years.
Yes.
But then I did this kind of body intervention with, the eye movements, bringing up this trauma in a controlled environment. I had no idea that was the piece that had been missing in my therapeutic process and journey and healing for years.
Yes.
Right? And so until I tried it, I had no idea. And that's when I became an EMDR therapist. I went, okay, that's what's been missing. I'm going to go get trained. And that felt like such an important thing to me. But I had to be open to it. I had to try it. And again, I didn't even know what I didn't know.
Absolutely.
You know what I mean? Until I tried it.
Yeah. So I'm certified in a much lesser known modality called brain working recursive therapy, BWRT. It's very similar to ART. It just kind of comes from a different part of the world. And the way that I came across it was I worked with someone and I went, this is very, very different. It's a lot of her talking and the client internalizing what's going on. And she offered to do a session with me. And that one session changed things, like you said, that I had been working on for years and years, very core belief kind of things. Mm-hmm. And after a few days, I went, oh my goodness, I think that really shifted something. And I did some sessions with her. And, I've shared with you recently, like in the last year and a half. So I went to her probably about a year and a half ago, mm-hmm. and I did some sessions with her. And I have lost 75 pounds in the last year and a half. And I really can trace it back to that therapy just changed so much inside of me that I could finally tackle this thing that I had been struggling with for a really long time. And it really shifted everything in a way that it was work. It was emotional and hard, but it was very effective. And I felt like it was so much faster. Like you, I had done a lot of cognitive behavioral talk therapy previously, which was so effective. But these modalities that are coming out that are really they're working with brain scans and they're working with feelings in your body that you've had, that kind of connect over the years. And they really address those things in a way that it's almost magical. Like I've done BWRT with a couple of people and I did it with a friend of mine. And when we were done, she texted me and said, I think you're a witch now.
I don't know what to think about that. Right? That was amazing, right?
I took it as a good thing.
Yeah, that's a compliment for sure. We need witches. It's interesting because I think the reminder is, again, through some of these therapeutic interventions that really it's the client doing the work. Like we're helping guide them. Yeah. The client is the one doing the work and their brain is making the connections and doing the healing. And we're just helping guide them along that path, right? Mm-hmm. And to me, it's an amazing thing as a therapist because I don't have to have the best answers or have to have these, like when you said the oracle, I thought, you don't have to be that, right? But you can just help guide them and the healing and the processing that happens is quite remarkable. Yeah. So really great. Yeah. All right, Mary, is there anything that I didn't ask you that feels important that you want to touch on?
Yeah, I just wanted to get back. One thing that I want to say is trauma is real for everyone. Someone else's trauma being worse, more intense, something else does not invalidate your own trauma. And processing through that is what is really life-changing. And a lot of these modalities, I know I have a spouse who is in law enforcement and has a lot of really harrowing memories that he doesn't want to talk about. And a lot of these modalities you don't have to talk about them anymore. It's such an internal process, and it really does change things, but you don't necessarily have to live through it again. So don't be scared of shopping around a little bit. Get on TikTok, watch some videos, see what it's like, and you might be really surprised what you can find that is healing in a way that is not, 10 years of work and talking on a couch every Tuesday or whatever it is.
Totally. Absolutely. It doesn't have to be that. And it very rarely is. It's amazing the healing that can happen in actually a relatively short amount of time.
Yes.
So really great. Just to go over a few things that you talked about, I think are really important, is consultation with your therapist, that it's a collaborative approach. It is not just the therapist telling you what to do and checking in on your homework and what did you do and what didn't you do. But no, how's this working for you? Does this feel like it's helping? Are we moving the needle at all? Right? I think that's really, really helpful. To remember that referrals are really good. We, like you said, Therapy Utah, we live and die on referrals.
Yes.
So when people have a good experience with a therapist, we recommend them, right? That's what we do. And so to look at your friends and family that you trust and that you can see that they're trying to do their work, and ask them, who would they go to? Who would they recommend? And that we don't have to have therapists that are the same religion or gender, right? As long as they're affirming for our religion, our gender, our sexual preferences, and that they're recognizing where our values are and they're meeting us there.
Yes.
Really important, right? I love the red flags. So if there's any ick factor, you said, you know what that is. We don't have to say it. It doesn't feel right, right? And to recognize that to trust yourself. Like if there's something there that feels off, that's okay, right? And it's okay actually to say this isn't a good fit, or I've outgrown this therapist.
Yes.
Right? I had a therapist that was cognitive. Now I'm going to a therapist that's more body-based. Okay, great. That's not wrong. That's actually what you get to do, right?
Yeah,
So
and your therapist should be able to celebrate that and be excited and happy for you in that journey. Yeah.
Yes. And again, I think that's a really important indicator of a therapist who goes, you know what? We have done so much good work, and now it's time for you to do good work with somebody else, right?
Yeah.
Exactly. And to recognize that trauma is real for everybody, right? The way that you experience trauma is going to be different than the way I do, but it's nonetheless impactful on us. And that therapy is something that it's not a one-size-fits-all approach. It is something that really has to be individualized, and you have to trust yourself that you're the hero in your story. You're the expert in your life. And to recognize that, we can do our part as therapists and as clients, and that to recognize there may be great fits and there may not, and it's not wrong. It's not personal.
Right.
It's just that can happen.
Yeah.
It's part of the deal.
Yes.
Right.
And you should be comfortable with the person that you're getting vulnerable with. It's just
1,000%.
how many first dates did you go on and didn't go on a second date? It just didn't jive. And that can be the same thing with therapists.
100%. Well, we appreciate you tuning into the Therapist Question Box. And as a reminder, trust your gut, ask the hard questions, and do your homework so you can have the best therapeutic experience possible. If you found this episode helpful, please rate and review, and we'll see you next time.